Welcome to PO Medication Return. Hello students, good morning. I'm glad you could join me. We're going to be giving medications to Mrs. Cortez this morning. I've talked to her about the fact that you're going to come in with me, so let's get started. The first thing we're going to do is we're going to grab Mrs. Cortez's chart. We want to look through the chart, make sure we have Mrs. Cortez's chart, Mrs. Maritza Cortez. We're going to turn to the doctor order section. Okay, we've got to the physician order section. While we're looking and opening her chart, we want to check the chart for several things. We're giving her medications. We want to make sure she doesn't have any allergies. We want to make sure that she has no swallowing difficulties. We want to make sure she's not on any fluid restrictions. And we're going to flip to the medication section and read her order. We want to check for the rights of the medication. So we want to make sure the medication has a route. We want to make sure the medication has a dose. The medication has a time. We want to make sure we have the right individual. And we want to make sure that the medication order itself is done date and timed and written timely for this patient. This patient is on Lasix, 20 milligrams PO BID, potassium chloride 20 milliequivalents PO daily, digoxin 0.25 PO daily. We want to hold her digoxin if her heart rate is less than 60. Augmentin suspension 400 milligrams PO Q12 hours. And that is our order. We're going to take the chart, set it down, and gather our supplies. What we're going to need for her medication administration is a medication tray. We're going to need some medication cups. And we're going to need the patient's MAR record. So prior to getting started here, we want to wash our hands. Hand hygiene is very important throughout all nursing actions that we take. The other important thing with washing hands is letting our hand sanitizer dry prior to taking any action. So just rub your hands. You need the friction when you're using a no-rinse sanitizer. Okay, so we're going to open the medication record and we're going to find Mrs. Cortez. And this is what our medication record looks like. We're going to compare just for accuracy to make sure our medication order was transcribed correctly to her MAR. We see her Lasix 20 PO BID, her Lasix 20 PO BID, her potassium chloride 20 milliequivalents PO daily, her digoxin 0.25 PO 1 tablet daily, and her Augmentin suspension 400 milligrams PO Q12 hours. So at this point we are done with her chart. Since we've identified everything is accurate and correct, we're going to put it aside. Also at this time take her MAR out of the medication record here individually so that we can put this aside and have more room on our medication cart. At this point we're going to do our first medication check. So we're going to set up our medication cups and we're going to get out her medication drawer. Maritza Cortez, Maritza Cortez. We want to perform our first check by identifying our medications, first being Lasix. So we're going to look for the Lasix tablet. We have Lasix, 20 milliequivalent tablet, 1 tablet. And we look at the expiration date. This expiration is 5/2011, so that is good. The next is her potassium. Here's her potassium. It's 20 milliequivalents, 1 capsule. Expiration date 5/2011. So that is good. And the medication is all intact. The packaging is intact. Next one is her digoxin. Digoxin, 0.25 milligrams, 1 tablet daily. So we have 1 tablet, intact. Expiration date 9/2012. So that's good. And then Augmentin. It's 400 milligrams, and this is a liquid medication, so we need to look on the bottle and see the equivalent for the concentration. This Augmentin is 400 milligrams per 5 mL. So we know, being the dose is 400 milligrams, the patient needs to take 5 mL. And that is our first check. Okay, our second check, we're going to put our drawer to the side. We will perform, and then we will place it in the cup. First being is our Lasix 20 and 1 tablet. We're going to put that in the cup. Potassium chloride, 20 milliequivalents, potassium chloride, 20 milliequivalents. And put that in the cup. Then we have digoxin, 0.25 milligrams, 1. And we're going to put this in a separate cup in case the patient's heart rate is lower than 60 and we can't give the medication. And then last being our augmentin. Again, 400 milligrams per 5 mLs, 400 milligrams we need to get poured out. When handling a liquid medication, you want to put your cup on a flat surface. You want to pour and bend, open your cup. You want to cover your label so that you don't drip on your label when you're pouring. We're going to shake our medication bottle up well to make sure it's all mixed, and then remove the lid. Making sure that we put the lid upright to not contaminate. We want to bend down when we're pouring our liquid medication so we make sure that we can see the correct amount. And at this point, we could wipe off the top of the bottle so that we don't trip down and get onto the label. So this is our second. That was our second, and now we're going to do a third check because we're going to put this away and not bring the bottle with us into the room. So we want to make sure we have 400 milligrams of augmentin in 5 mLs. Augmentin 5 mLs. We've checked the expiration date. It expires 5 of 2011. And here's our 5 mLs. Okay, we're going to put the augmentin away. At this point, students, we're ready to go meet Mrs. Cortez and bring her medications. We're going to get to the room. Okay, students, right here, here's Mrs. Cortez's room. You want to knock? Hi, Mrs. Cortez. I'm Patty Donahue, your nurse. Do you remember we talked this morning that I was going to bring my students by to meet you?
Yes.
Here's my students. Thank you for letting them come in and watch us give your medications this morning.
My pleasure. Thank you for
coming. What we're going to do, students, is we're going to put our medications down in our MAR, making sure that you bring the MAR with to perform your third check on your medications. Before doing any patient care, we're going to always wash our hands and provide the patient with privacy. This is our right patient. So we're going to look with our MAR at her armband. Maritza Cortez. Date of birth 6/30/1970. Maritza Cortez, date of birth 6/30/1970. Okay. Mrs. Cortez, I'm going to raise your bed just a little bit if you don't mind.
Not at all.
Have it up a little bit. Okay, and then I'm going to raise your head up a little too. Can you tell me, Mrs. Cortez, if you have any allergies?
No allergies.
All right, because you know, doctor is starting you on a new antibiotic, so I want to make sure that that's safe to give to you. All right, so students, regarding her medications, one thing that we needed to do prior to giving was check Mrs. Cortez's pulse, apical, because she's on digoxin. And in checking an apical pulse, you want to make sure that you check the pulse rate for 1 minute. So we're going to go ahead and do that. I think it's always good for infection control purposes with whatever equipment you use to clean off prior and after to patient's use. If it's a piece of equipment, you use patient to patient. In checking the apical pulse, we want to go skin to our stethoscope. I'm going to just lift up your gown a little, Mrs. Cortez. And we want to go apical, so finding the apex of her heart. And we are going to listen for 1 minute. Okay, very good, Maritza. Your apical heart rate is 78 and very regular. That is great. So we can give Mrs. Cortez her medication because her pulse is above 60. Mrs. Cortez, do you like to take all your medications at once, or do you like to take them individually?
All at once.
All right, very good. We're going to get you some water. And we have identified that Mrs. Cortez doesn't have any swallowing issues, and she is not NPO. Okay, we're going to perform our third check prior to giving your medications. And then we will open them. So first we have the Lasix, the 20 milligram tablet, and 1 tablet. We're going to pop it open and put it in her cup. Dispose of the wrapper. Potassium chloride, 20 milliequivalents. Potassium, 20 milliequivalents. 1 capsule. Pop it in and throw the wrapper. And now we know we can give the DIG, 0.25 milligrams, 1 tablet. Pop it in and get rid of the wrapper. And we have our Augmentin. I'm going to pour you some water, Mrs. Cortez, and then I'll hand you your pills. There you go. And some water. Do you need some more?
No.
Very good. And now your Augmentin. Your water? Is that good?
Mm-hmm. Thank you.
Okay. And talking about your medications, Mrs. Cortez, your Augmentin, this is a new antibiotic doctor started you on for you have a little bit of a respiratory infection. This medication may upset your stomach, may make you a little crampy, or change your stools to a looser stool. So if those things are occurring, you want to let us know. Some patients, students, don't really tolerate certain antibiotics well, so we would want to make sure that we knew that and notified physician if Mrs. Cortez was having some problems with that. Mrs. Cortez, you're also taking Lasix. Do you know what this medication is?
Yes.
Can you tell the students?
Well, it's a diuretic, and that means that it causes me to release water, and it keeps my swelling down, and it has something to do with my heart, but I'm not exactly sure. I just take it.
You are very knowledgeable, Mrs. Cortez. When there's too much fluid on the heart, that's a strain, so we want to get those fluids diuresed off. So doctors put you on this Lasix, and you're responding really well to it. And you are exactly right, student. She knows a lot about her medications. Doctor also has you on potassium, which is a supplement. Because you're on the Lasix, doctor wants you to take this potassium supplement to make sure that your electrolytes don't get off. So we'll be monitoring and doing blood draws on you to check to make sure that your potassium level is good, as well as your other electrolytes. The last medication, Mrs. Cortez, is your digoxin. And this medication is for your heart, to regulate your heart rate, and that is why we check your pulse to make sure that your heart rate isn't too low before giving that medication. Now with your Lasix, you know, that may make you have to go to the bathroom more, so if you need some assistance, you give us a call and let us know. Is there anything else we can do for you before we leave you, Mrs. Cortez?
Will you just turn off the TV?
I would love to. Okay? And I'm going to reposition you. I'm going to put your bed back down, Mrs. Cortez. And also, would you like to go flat or sit up a little bit more?
No, I like sitting up. Thank you.
Okay. Here's your call light. I want you to make sure that you call me if there's anything you need. I'm going to put your bedside table a little closer to you and leave you with some water. And I'm going to open back up your curtain. And then as always, we want to make sure that we wash our hands. Okay, Mrs. Cortez, I'm going to be back to check on you in about 20 minutes to see how you are doing. Okay, students, we're going to progress out to the nurse's station and finish our documentation there. Okay, back at the medication cart, we're going to document in our MAR record. We're going to document off on each medication. Going along by the box, we're going to make sure we put today's date and our initials next to each medication. It's important by the digoxin that we record the patient's heart rate, which we are going to put on the line below our initials. At the very bottom, we're going to put our initials so people can know whose initials these are, and our full name and our title. So that's what we're going to do right now. Documentation, remember students, Dr. Tim, the last D being documentation. At this point, this concludes the PO medication return.
Eye medications.
The nurse will begin by checking the doctor's orders, comparing the MAR with the doctor's order sheet, correctly reading the MAR including any abbreviations. He should wash his hands before handling the meds, check the medication and dosaging 3 times before administering, and he should identify the 5 rights of medication administration.
So I'm going to check my med in the med room, at the bedside, and right before I administer, making sure it's the right patient, right medicine, right route, right dose, and right time. Hi, how are you?
Good, thank you. How are you?
Good, thank you. I'm Brad. I'm going to be your nurse today.
Oh, okay.
Can you tell me your name?
Judy Garland.
Judy Garland. Hello, nice to meet you. I'm just checking her name. Judy Garland, medical record number. We're right. So this is the right patient, and I'm going to double check. Yes, we are giving 5 drops of Visine into the right eye. That's what this says right here. All right, let's do it.
The nurse will choose the correct eye to instill the medication and instruct the patient to tilt her head back to the side and look up.
Can you tilt your head back to the side and look up? Thank you.
He will then drop the appropriate number of drops without touching the eye or eyelid.
To the inner. When you do this, you want to open up the conjunctival sac and instill 5 eye drops in this case. 1, 2, 3, 4, 5. Close the eye and apply pressure for a few seconds.
This light pressure should be applied to the inner canthus for 5 to 10 seconds.
Okay. It's probably best to not use this wipe cloth when you're applying the pressure, as it will absorb the medication. So I'd actually just use your finger and then wipe it clean when you're finished.
He will remove his gloves correctly and dispose them in the trash. Ensure the client's comfort and safety prior to leaving the room, and then document the administration of the medication in the appropriate place on the MAR.
Are you comfortable?
Yes, thank you.
Alright, I'm going to do my environmental assessment. Bed is in the lowest position, side rails up, and then I'm going to leave the room with her call light in reach, and I'll document, and then good to go.
Hi Mary, it's Kylie again, and I'm now going to show you the skill of instilling ear drops. So before I would go into the patient's room, I would check my medication to make sure I have the correct one. I would check it with the MAR, the physician orders, and my Cardex. I would check the dosage, the amount, the time it's to be given, the route, and that I have the correct patient. I then would take my supplies into the patient's room, which would be the medication itself, the dropper, a small cotton ball, and the MAR physician orders and the Cardex. So I would go into the patient's room, I would introduce myself, I would perform hand hygiene, I would then check the patient's wristband to make sure I have the correct patient. I would ask the patient to recite his name and date of birth to me. I then, again, would double check my medication with the MAR and the physician orders. I then would, depending on the medication, I would pour a small amount into a medication cup. I would not want to stick my dropper directly into the medication for the risk of contamination. So I would pour a small amount into the medication cup. I would have the patient laying in a supine position with the affected ear facing up. So in this case it's his right ear. So I'll have that positioned upwards. I then would take my medication and my dropper. I would suck up the medication. For a patient over the age of 3, I would pull the ear slightly upwards and towards the back of the head. If a patient was under the age of 3, I would pull the earlobe slightly down and back. This just helps to open up the ear canal. So in his case, I would pull the ear up towards the back of the head, insert the dropper, instill the medication, take the dropper out. I would take my small cotton ball, place that in the ear. I would then have the patient lay in this position for 5 to 10 minutes to ensure that the medication makes its way all the way through the ear canal. I would then perform hand hygiene. I would then let the patient know I would be back to check on him in 10 minutes. And that is the end of the eardrops.